Are you someone who snores? You might want to take this video as a warning and pay attention to your sleeping partner as snoring. We are about to reveal one of the most terrifying sounds that could be the only thing standing between you and an early grave. And it is not what you think, but before we do, don't forget to hit that like button for more videos. Now let's get back to the deadly sound. This particular sound can go unnoticed by many and often is just seen as a quirky habit. However, there have been studies showing that if you snore in this way, you may be at risk of having a heart attack or a stroke. This is because of the way that the body reacts when someone is snoring loudly. So, what exactly makes some snores so deadly? The answer lies in a condition known as obstructive sleep apnea. If you aren't familiar with this condition, it can be difficult to detect as the sufferer will usually be unaware of their symptoms while they reawake. Obstructive sleep apnea is when the throat closes off while someone is asleep, preventing them from breathing properly. This can cause the sufferer to stop breathing anywhere from a few seconds to even a couple of minutes. Then they will start to suffocate and their brain will automatically jolt them awake long enough for them to take a breath. And this cycle will repeat itself over and over again throughout the night. If you're thinking that this doesn't sound too serious, just consider how much damage can be done during those few minutes each time around. First, let's imagine what is happening to the heart. Every time the sufferer stops breathing, their heart rate increases and their blood pressure rises dramatically as the body tries to force oxygen into the lungs. As the cycle continues throughout the night, this constant strain on the cardiovascular system weakens the arteries and raises the risk of heart disease, heart failure, and stroke. Not only this, but the sufferer's brain is also being deprived of oxygen, which can cause feelings of tiredness and lack of concentration during the day. It has also been linked to memory loss and dementia. It is estimated that over 1 billion people worldwide suffer from sleep apnea, and the numbers are rising. Studies show that the condition affects men 3 times more than women, but why is it getting worse? A recent study conducted by Harvard Medical School found that over a 30-year period, the number of people who died from the effects of untreated sleep apnea increased by almost 300%. Even more concerningly, it was found that 1 in 5 people over the age of 50 now snore, and 22% of them have high blood pressure, which is a common symptom of sleep apnea. You might be wondering, why is sleep apnea becoming more common? It is believed that it could be due to the increase in obesity rates. When the throat closes off during sleep apnea, it is usually caused by excess weight around the neck restricting the flow of air. Other factors such as large tonsils or a genetic predisposition can also play a role. So how can you tell if someone is suffering from sleep apnea? Well, the first clue is, of course, snoring. While many people snore occasionally, those with sleep apnea do it every night and it's much louder. Another sign is that the person will often wake up with a sore throat or dry mouth because of the constant rebreathing of air during the night. During the day, the sufferer may experience extreme tiredness or struggle to concentrate. They may also have high blood pressure or have a receding hairline. Sleep apnea causes the body to produce more cortisol, which is the stress hormone. Too much cortisol in the body can cause hair follicles to shrink, leading to a receding hairline. While these symptoms may seem alarming, there is no need to panic. Most of the time, sleep apnea can be treated with surgery or a simple device worn while sleeping. So please do not attempt to diagnose yourself based on this video alone. Instead, share it with your loved ones so that they are aware of the signs of sleep apnea. You may be wondering, what is the best way to find out if you or your sleeping partner have sleep apnea? Well, fortunately, there are many simple tests that can be done to determine whether or not you are at risk. The easiest test is called the Epworth Sleepiness Scale, also known as the ESS. This involves answering 8 questions regarding how tired you feel during the day. If you score over 10 on this test, then you may be at risk of sleep apnea. Another test you can try is the Stop Bang questionnaire. This one has 10 questions and focuses more specifically on the symptoms of sleep apnea. Once completed, the answers will indicate whether or not you should visit your doctor for further testing. There is also a physical examination that can be carried out by your doctor. This will involve checking your neck size, listening to your lungs, and asking questions about your medical history. If your doctor suspects that you have sleep apnea, they may also perform a sleep study. This is when you spend a night in a lab while doctors monitor your brain waves, heart rate, blood pressure, and breathing patterns. Let's take a look at how you can protect yourself and your loved ones from sleep apnea. Firstly, maintaining a healthy weight is essential. Excess weight around the neck restricts airflow, increasing the likelihood of sleep apnea. Exercise regularly to keep your body in good condition and reduce any excess fat. Pay attention to your alcohol intake. Drinking too much alcohol relaxes the throat muscles, making it more likely for the airway to close off during sleep. If you have a particularly busy and stressful day, try to relax before bedtime. Take a warm bath or read a book to calm your mind. Practice good sleep hygiene. This means going to bed and waking up at the same time each day, even on weekends. Having a regular sleep schedule helps regulate your body's natural sleep-wake cycle, making it easier to fall asleep and stay asleep. Make sure that your bedroom is dark, quiet, and well ventilated. Use blackout curtains if necessary and invest in a physical alarm clock instead of relying on your phone. This can help prevent you from being jolted awake by incoming calls or messages. Consider using a humidifier. Dry air can irritate the throat and lead to inflammation, making sleep apnea worse. Use a humidifier to add moisture to the air and breathe more easily during the night. Don't smoke or use tobacco. These substances can relax the throat muscles and worsen sleep apnea symptoms. Quitting smoking not only helps with sleep apnea, but also improves overall health and reduces the risk of other diseases. Be mindful of the size of your tonsils. If you have enlarged tonsils, they can contribute to sleep apnea by blocking the upper airway. In such cases, consult with your doctor about the possibility of tonsillectomy surgery. Sleep apnea is a serious condition that should not be taken lightly. Taking steps to protect yourself and your loved ones can make all the difference in preventing potentially fatal complications such as heart attacks and strokes. Remember, sometimes a single snore can be the only warning before a life-threatening situation. And now it's time for you to make your voice heard. What did you think of this video? Let us know in the comments below. And if you haven't already, don't forget to hit that like button for more informative and entertaining content. Thanks for watching.